Welcome to this CSG webinar. I'm Sean Sloan, Senior Policy Analyst at the Council of State Governments in Lexington, Kentucky. Today we're going to talk about efforts to combat online misinformation during the coronavirus pandemic. We're going to learn how Facebook, a CSG associate, has taken steps to stop misinformation and harmful content, support global health experts, state and local governments, businesses, and communities, and provide access to accurate information. We'll also hear how the Washington State Emergency Management Division used Facebook's platform and reach to get its messaging out. In addition, we're going to hear how events during the pandemic have drawn attention to social media's varied approaches to content moderation, how successful those approaches have been, and the challenges that remain. We have three presenters joining us today. Eva Guidarini is State and Local Politics and Government Outreach Manager at Facebook. Stephen Friedrich is Public Information Officer at the Washington State Emergency Management Division. And joining us later in the program will be Dr. Emily Vraga, Associate Professor at the University of Minnesota, Hubbard School of Journalism and Mass Communication. Eva, we want to begin with you. What can you tell us about Facebook's approach to misinformation during the time of COVID?
Thanks so much, Sean. I'm so excited to be here. My name is Eva, and I work on our state and local government outreach team at Facebook. And if we can go ahead and click through to the next slide. So in response to the coronavirus pandemic, if we can go back one, Facebook is really focused on supporting our global community, and we really have a multi-pronged approach to this process. So the first thing we want to make sure is that everyone has accurate information about the pandemic and about how to respond and how to stay safe. So we really want to make sure that that good authoritative information gets out there. Second, we want to stop misinformation and harmful content from propagating on the platform. So both getting out that good information and stopping that bad information. And there's a lot of different ways that we do that, but I think two really key pieces of that are both supporting global health efforts and relief efforts, and then also supporting local governments, communities, and businesses that really make up our platform and are the places where people are getting a lot of their good authoritative information. So we'll dive into each of these a little bit more as we go through the slides. We can click through the next one. So the real sort of center of Facebook's product-based response to the coronavirus pandemic was the COVID-19 Information Center. So this was basically a surface on Facebook that had a bunch of authoritative information about the COVID pandemic, and it is actually still up on the platform. We put this surface at the top of every user's newsfeed on Facebook so that everyone could access this real hub of authoritative information. In this hub, we pulled in posts from state and local and national health agencies so people could have that authoritative information to their government. We linked folks to the CDC right at the top of that hub. We had great information from the World Health Organization. And we also gave users groups to help them sort of connect with their community and ask for or offer help if they needed it. So this was really just a great central source of authoritative information, a place for folks to ask for help, and something we were able to promote to all users on the platform. So sort of a really great centralized place. Click through. Go to the next slide, please. So one of the features that we had in this sort of coronavirus hub was called local alerts. Local alerts is one of my favorite tools on the platform, and it's fairly new. We actually expanded it nationally to the whole country as a result of the coronavirus pandemic, but it's a tool that gives state and local governments and first responders access to mark a post as a local alert. When a post that is urgent and need to know in a community is marked as a local alert, we actually send out a notification to everyone that follows the page that sent out that alert, and you can see what that notification looks like here on the left-hand side. We also mark a post that is marked as a local alert with that sort of special triangle and newsfeed, helping it to get a little bit more attention. But during COVID, we also pulled local alerts, and you can see here a local alert showing up in the COVID hub from the County of Santa Clara. but we pulled those local alerts and we put them at the very top of the COVID hub. So if I lived in Santa Clara and I opened the COVID hub at a time in which the county of Santa Clara had issued a local alert about an important update about how my community was responding to coronavirus, I would see that local alert right at the top. I think this was all the more critical during COVID because states and cities were responding so differently to the pandemic that people really needed local information as well as sort of that broad global and federal information. So local alerts were a really great way to help us help local governments who were doing the real hard work on the ground here get their message out without having to spend any ad dollars and really get some reach on those important messages as they tried to reach their communities. We can click through the next slide, please. So another product feature that we rolled out was a search inform module, which is a very long word to basically just say that whenever somebody looked for COVID-19, coronavirus, whenever someone searched on Facebook for something about the virus, we would give them a little pop-up and say, hey, are you looking for coronavirus information? And we would encourage them to go to the WHO. So we wanted to make sure that as people are searching, we're driving them right at the top of those search results to authoritative resources to make sure that they can get the information that they need. Click through the next slide, please. And we also ran reminders at the top of people's newsfeed. So not only did we sort of run information about that COVID hub, that sort of centralized source of information at the top of newsfeed, but we also ran other reminders that we worked really closely with the WHO on sort of important messaging, right? Remember to wash your hands and not touch your face. All of these sort of updates, remember to socially distance. So these really top of feed reminders giving people sort of broad information that they needed about pandemic response. Um, and we're actually still running these coronavirus reminders. We've recently launched a set of them that are around wearing masks, encouraging users across the platform in the United States to be wearing masks as a part of the response. So this is a really great way that we can put a notice right at the top of folks' news feed and make sure that everyone who visits the platform that day gets to see this important message. Click through the next slide, please. And we also want to make sure we understand that sort of we are not the authoritative source of information here. So as you see in all these products, really they're designed to promote information coming from government and NGO sources. But we also wanted to make sure that we were financially supporting the communities that were doing a lot of this work for us. So in addition to grants to small businesses, we actually gave $100 million to local news organizations who were doing a lot of the Herculean hard work about getting the information about coronavirus out there. And we gave $1 million to support our fact checking partners who were also doing great work in sort of helping to take down and find and correct that incorrect information on the platform. So we wanted to make sure that not only were we sort of promoting the work they were doing on the platform, but that we are also being good financial partners, given that we rely so heavily on the good information that they're putting out there. Click through. So sort of what we've talked about to this point is a lot of what we did to make sure that we were getting good authoritative information out there and supporting the folks who were providing that good authoritative information. But we also made some changes and made a lot of updates to make sure that we were also getting down the bad stuff. So one thing that we've recently been able to do is to start showing messages in newsfeed to people who have liked, reacted, or commented on harmful misinfo about COVID that we've since removed. So let's say you saw a post about COVID that had some harmful misinformation about it. We caught that post about an hour after you saw it and then took it down. We can now actually send you a message after the fact and say, hey, you might have seen some misinformation, and then connect you to the WHO or another authoritative source to help you see the correct information about that. So even if we didn't catch it right away, it's just a great way for us to sort of move backwards and make sure that if folks did see harmful misinformation, that they can get that correction. We also added a very specific section to our voter intimidation policies about COVID and coronavirus. So statements like the election is canceled due to the pandemic violate our community standards and can be removed. As everyone here I know is surely well aware, the pandemic was incredibly hard on the primary election season and will make this a very interesting 2020 election. So we want to make sure that it doesn't give folks additional opportunities to spread sort of voter suppression messaging on our platform. We also displayed warnings on about 40 million posts related to COVID-19 on Facebook in the month of April. Those warnings came from our third-party fact checkers who can fact check and label content on our platform. And we saw incredible success. When people saw these warning labels, 95% of the time they actually didn't go on to view that original content that had been rated as false or partly false by our fact checking partners. So we're really excited about how well those treatments worked. And so this was sort of a combination of the work that we did. And you can see here about 4,000 articles about COVID rated false in the month of April by our independent fact checkers. So this was sort of how we were helping to stop some of that bad content from propagating on the platform as well. Thank you so much.
Eva, thank you very much. Stephen Friedrich is a public information officer at the Washington State Emergency Management Division, an agency that made extensive use of Facebook's platform and reach during the pandemic to get important messages out to the people of Washington. Stephen, what can you tell us about the approach your agency has taken during this time, the kinds of things you're sharing and the messages you've been trying to convey? And just let us know when we need to change the slide for you.
Hi, yeah, thanks. Had to unmute myself there. So hi, I'm Steven. I was a journalist for 15 years. And I worked for our agency, which hosts the Washington National Guard and Washington Emergency Management Division since 2014. And the picture you're seeing here, this is one of the places where I work. This is our State Emergency Operations Center. You can see everyone in the photos wearing a mask, and there's lots of empty seats to keep social distancing. For a long time, we had a unified command with our State Department of Health. Let's go to the next slide. What you see here is that's Vice President Pence, who visited our State Emergency Operations Center back in March. Our state had the first confirmed case of COVID-19. The timeline shifted somewhat, where it's thought the virus was entered the country much earlier than that, but our state EOC might have been the first in the nation to activate for COVID-19. So on March 5th, we did have Vice President Pence visit. So no masks, no real social distancing. The messages at the time were vastly different than what I showed in the first slide, and that's why I showed it first. But some of our messages at the time, like our state and the CDC both said masks wouldn't help, have come back to haunt us. Even yesterday, I had someone bring this up as a reason why they wouldn't be wearing a mask today. If it was good enough in March, it should be good enough now, they say. Of course, our scientists are saying different things, and that has been really hard to get through to folks. Let's do the next slide. So a lot of the items on this bulletin list are pretty obvious, but before we did our first stay-at-home order, I knew we'd have a whole lot of angry people who would probably be cussing up a storm, sharing bad info for folks, and we had a pretty open page with folks who could leave reviews and send us messages on Messenger. I'm a big fan of profanity filter and moderation words, which I always add to. For instance, the middle finger emoji is not typically blocked, even under a heavy vulgarity filter. And when I block the yellow middle finger emoji, it doesn't block any of the other color middle finger emojis. People are always finding new ways to cuss. So despite turning a lot of things off, we did keep the ability for visitors to post their own post to our page as a means of reaching us. I had one person who was going to have their commercial driver's license expire, leave us a Facebook post. And I was able to connect them to the right folks at the Department of Licensing so that they could keep their CDL. Removing photo comments was a super hard step for us because I'm a big fan of photo memes. We finally turned that off last month after just so many people were abusing it. They just kept posting these pictures all the time with middle fingers and cussing, just ways to get around the vulgarity filters. And even though I turned off the photos as an admin, I can still post them as a comment if necessary. We have pretty clear content guidelines. That's a good tip for folks. We posted it on our Facebook page. No elections, no vulgarity. Our state also has pretty strict Public Records Act, so I'm a big fan of Facebook auto hiding messages. That way they don't ever get deleted by us. It can still be retained as records. Comments have been trending negative lately for us, but if you click shared posts, the comments we're seeing of public posts are pretty positive. We also are able to post information, Facebook's COVID-19 info, like Eva demonstrated. Next slide. Next slide. Oh no, one back. Thank you. We're big fans of delivering information to folks who speak multiple languages. Here's a quick tip under settings where you're able to have both English and Spanish versions of the post appear in the same post. So as a user, if your settings are English, you won't see the Spanish version, for instance. This controls a lot of trolls who otherwise would be screaming about why they can't understand the post in front of them, and makes more sense for us rather than just posting in Spanish only. On Twitter, we also do dual language posts where we thread them together. Next post. We also did Spanish language outreach to those who just speak Spanish using Facebook ads, and found a lot of success and engagement from folks sharing it and liking it and commenting. People who just spoke Spanish were able to find information from confirmed sources and express appreciation. We have staff that speak Spanish who were able to reply to folks' questions. It was just it's been a really good approach. Plus, with the CDC and the ad council had ads that we could take. So video posts typically got larger reaches anyway. So we were able to take a video from the CDC and incorporate that with some of our messages, and found success there. Next slide. So first, I was pretty much handling social media alone for a while there, and that just didn't become feasible for me or my sanity. So at some point, we had up to 6 people chipping in to help from around our agency and activation to make sure we were all on the same page. We all had talking points that we would share. We also had a joint information center for multiple state agencies where we all contributed messages. We take their messages to. The goal is to amplify all the messages from the different states as much as possible to find out trends of what people wanted to know. Like folks wanted to know about unemployment, where to find food banks, why the National Guard was activated. I found on an extremely popular post, people will actually start correcting each other using our own talking points. And so that was really helpful. I'm also a big fan of stepping away from the computer, going for walks, putting your phone down, taking a break, finding something else to do. Super important when you deal with folks who are just full of anger and hate. Next slide. Sometimes talking points just don't work out though, or new issues would emerge. Like someone took a clip of our governor talking at a press conference and made it edit it. So if you support the First Amendment, you don't have to wear masks. We ignored it for quite a while, but it wouldn't go away. After we started replying to it, really haven't seen the comment so much anymore. Sometimes we're making posts and folks will, they'll come into it, as you see when the one comment, hey, you know what, you can't prohibit me from anything. It's like, well, hey, this isn't our agency. We didn't do that. And they reply back, oh, okay, thanks. Or folks will really like it. Hey, somebody said I deserved a raise. So that was kind of cool, folks. Next slide. So we have plenty of folks who are just angry about what's going on. They've lost their job, the school shut down, they can't see the latest movie, or maybe someone they love got COVID-19 and they think the state just didn't do enough. So we just need to accept that we can't make everyone happy. Sometimes, a lot of times, people are asking legitimate questions or making legitimate comments. Yesterday, I had people asking about whether libraries or churches could be open. They wanted to know where to find information on unemployment, if camping's open, the latest from the county. It's interesting, but sometimes I'm doing a Google search for information for them to give them a link that I know they probably could have found themselves, but they appreciate it. Sometimes people willingly spread misinformation, and even confronted with the truth, they don't believe us. Here, I unhid this message just so I could screen grab it to show someone who admitted they're spreading lies on purpose. The other message is from a user who on their own debunked a lie, and I found the reply really fascinating. So we start off from a posture that maybe these folks are just misinformed. They appear conservative. Maybe I can find a Fox News story that talks about masks or staying home that would help them understand. I say Fox News because I made the mistake once of sharing a story from CNN to the wrong person once, and they discounted it right away because it was CNN. I have given links to Fox News to show masks work, like the president's wearing a mask now, and suddenly some of these folks are understanding. Next slide. I reached out to Eva in March. By complete random chance, local alerts became available in our area that month. So kudos to her team. We have used this quite a bit to combat rumors and misinformation and even wildfires that are happening in the middle of all this. We had people posting laminated cards saying that they created them and gave them a walk into any business they want, even though they weren't really exempt. Well, that's nonsense. We said so. We also help businesses by showing them the accommodations they can make to folks who don't wear masks, such as curbside service. We used it a lot about scams and FDA recalls and hand sanitizer, but we have to be careful we don't abuse the alerts. It's rare for us to use it more than once a day, maybe just a few times a week, or maybe just an individual county about to experience a wildfire. Next. So beyond our efforts on Facebook, we've also been actively on Twitter, Nextdoor. We really like Nextdoor's poll feature, allows for elaborate answers like the mask question. We also post more frequently on Twitter than our other platforms. Twitter is a good way for us to connect with our state's media. For our state, Mount St. Helens is a disaster that can actually be compared with COVID-19. There were scientists saying this volcano is going to erupt, areas around the volcano where nobody could go. After the eruption, everyone had to wear masks. A lot of folks had to stay inside. Even though it wasn't a health disaster per se, it had a lot of information folks could relate to. We repeated this message in May, but this one tweet got picked up quite a bit. Next slide. And this is an example when we used Twitter to connect with folks about them not injecting themselves with the disinfectant. It was spurred by a press conference where folks were misunderstanding a comment. Since it was a potential danger to folks, it was important to let them know where to get the right information. We all saw a couple of years ago where people did eat Tide Pods and got seriously ill. Our state's Poison Control Center had already seen people get ill by wiping down apples and groceries with disinfectant and then eating them. That was even before the press conference. Last slide. So this is my contact info. Feel free to follow us on Twitter, Facebook, reach out via email. For us, social media is just one of the ways we get out information. For me, it's always been social media first, press release next, or maybe not ever. Thank you.
Thank you, Stephen. Well, so far we've heard about Facebook's approach to misinformation during the crisis and how one user took advantage of its capabilities. I think as we've seen over the last few months, the pandemic has brought to light a number of things about not just Facebook, but its competitors in the social media space, as well and how those platforms engage in the process of content moderation. To help us get a sense of these issues, we want to turn to Dr. Emily Vraga, who is an associate professor in the Hubbard School of Journalism and Mass Communication at the University of Minnesota, where she holds the Don and Carol Larson Professorship in Health Communication. Her research focuses on how individuals respond to news and information about contentious health, scientific, and political issues in digital environments, including how to detect and correct misinformation via social media, especially on health topics. Dr. Vraga had a previously scheduled speaking engagement, but she recorded this presentation for us. She will join us for our Q&A session in just a few minutes, but here is her presentation.
Hello, my name is Emily Vraga. I'm an associate professor in the journalism department at the University of Minnesota. I'm going to talk a little bit today about some of the efforts that platforms and health organizations are making to combat misinformation on coronavirus on social media. So first, I want to start by emphasizing something that's new. The platforms are coordinating in a way that we've never seen before. So this is a press statement from all of the leading social media platforms: Facebook, Twitter, Google, which owns YouTube, of course, Reddit, saying that they're going to be working together to address COVID-19. And I think this is really important, not just as a signal, but as a way to make sure that the lessons learned by one organization, by one platform, are being shared across different platforms, as well as making the user experience more consistent across platforms. So what are these approaches? The first, and I think most consistent one, is that all of the social media platforms are promoting accurate information, especially via their search functions. So if you search for coronavirus, if you search for COVID-19 on pretty much any social media platform, what the first thing they're going to try to do is direct you to highly credible expert organizations. So on Facebook, that's the COVID-19 Information Center, where they have common prevention tips, and then they highlight some of the leading organizations on the issue: the CDC, Johns Hopkins, other local health organizations, for example, all can pop up here. And they're the first thing that you see when you're looking for coronavirus information. Now, it's certainly possible to look for posts from friends specifically, but this is your first step. On Twitter, you have something very similar. When you search for the information, it does show you the feed, but at the top of the feed is Know the Facts, directing you to the CDC. And on YouTube, on any video about coronavirus, this is what you see at the bottom, directing you again to the CDC for information about COVID-19. And while this seems like a simple strategy, it's one that's likely to be quite effective. We know that one of the ways in which misinformation flourishes is when there's an information void. When people are looking for information but can't find it, they're going to keep looking. Their needs must be satisfied. And if they're not going to find high quality information, they're going to find low quality information, and that will influence their attitude. So making it likely that the first thing they see is this highly trusted information from the most credible sources is going to eliminate that continued search for a lot of people and make sure that the best information is informing their attitudes. Now, that's not to say that this has solved the problem. For all of these, you can still continue on and look at posts from friends or look at a Twitter feed that might contain misinformation. So what are the platforms doing besides promoting high quality information? Pretty consistently, what they say they're doing is first trying to reduce the spread of misinformation. So once something has been classified as misinformation, and that once it's been classified is really a critically important detail, algorithms attempt to reduce the spread. So you're less likely to see that come up on your social media feed if you're on Facebook or Twitter. You're just less likely to see it, and if you don't see it, the odds are it's not going to influence you. Second, even if you do still come across this misinformation, because removal is kind of the last step and something that's used much more rarely, most of the platforms are using some kind of warning or label for the misinformation. So on Facebook, for example, they often put a gray screen on top of it and tell you what the facts are, as well as saying this is misinformation. It could also be the related stories function that it pops up fact checks related to the story underneath it. Warning labels on Twitter. All of these have the goal of telling you two things. One, this is misinformation, so be cautious. And two, here's what the accurate information is, and here's where you can get even more information. And research suggests those types of steps can be effective. If you tell people that something is inaccurate, and importantly, make it really easy for them to know what it is accurate, and give them that expert source, they're more likely to believe that. And less likely to believe the misinformation. It doesn't solve it completely. There are people who are going to remain convinced of the misinformation or be distrustful of the sources that you're providing them, but it is a good step in helping reduce that likelihood and reaching a lot of people who otherwise might be left with misinformation. You always want to leave people with accurate information. Most people will uptake that accurate information and discredit the misinformation. Finally, removal is certainly noted on all of the platforms as a potential possibility. So on Facebook, they say it's the danger of imminent harm will lead them to remove content rather than just reduce its spread or adding warnings. On Twitter, it says severe propensity for harm. Now, I think these are important, but also a little bit vague. When it comes to an infectious disease like COVID, every single decision you make doesn't just influence you, but influences your entire community. So trying to define what severe harm or imminent harm is when really a lot of different behaviors could be quite harmful, and it's really difficult to know just how harmful they're going to be, is a gap where we need to be pushing to have a better sense of when is removal possible, when is it going to be helpful, and when could it potentially backfire by making people more skeptical of the platforms themselves, versus having these warnings or these labels or reducing the misinformation spread without removing it. There's been some evidence of mixed success in efforts to respond to or label misinformation. So again, that's one of the ones that the platforms say they're doing. If it's misinformation, we're going to label it. So there was one study out of the UK, I provided the citation right on the bottom of the slide here, that found that about a quarter of content on Facebook and YouTube that had been debunked, that had been said to be false via these fact-checking sites, remained on these platforms without a label. That number was 60% for Twitter, so quite a big difference between the platforms. Now, part of that could be the fact-checking websites that they're basing this information on often align with Facebook as part of their initiative to detect misinformation and respond to it, but it still introduces this idea that Twitter might be not as effectively responding to misinformation as some of the other platforms, and an opportunity for them to do more in this space. Another way of looking at that is not just in terms of things that we know to be false that are continuing to spread, but how much misinformation is there. This is a little bit harder to identify just because misinformation is rapidly evolving, the content's rapidly evolving, and even our definitions of misinformation can be quite fraught. And I'll come back to that in a minute. But one study found that 25% of the top ranked most engaged with videos in March on YouTube contain some form of misinformation on the topic. And it's not just ordinary users sharing it. It can be entertainment websites, for example, that are promoting misinformation inadvertently, but still with the possibility of pernicious influence. I think the other thing to note is the gap between when something is being spread and when it's identified as misinformation can be substantive. And for all that time, you have misinformation spreading with no responses from the platform. So this study that shows only 25% remain with no labels, that's after it's already been identified to be false. That time between it starting to spread and it being identified as false is also critical in reaching a lot of people. Another way of thinking about this is looking at whether users can help facilitate this response. So the Center for Countering Digital Hate worked with volunteers to look for misinformation on these different platforms and flag the misinformation for the platforms to hopefully enable their response. And what they found was this was not a very effective technique. Only about 10% of the misinformation that they flagged had any action taken. And we see, again, those differences where Facebook and Instagram, which is owned by Facebook, were responding to more of that misinformation by removing the post or flagging it as false, whereas Twitter was doing that more rarely. I think this is really important because, again, that gap between when misinformation starts to spread and the platforms can respond is all time where that misinformation is affecting people. And moreover, misinformation can be quite imaginative. It's not bound by reality. It can be anything. We need to be relying on people to offer a community response. Now, that's not to say that we can rely on this solely. There's always the risk that people are going to try and game the system to troll and point out things that they disagree with as misinformation. But a more robust team that works on moderating and identifying what content that people are flagging is in fact false would be helpful in helping address misinformation. The other big trend I want to talk about is top-down misinformation, thinking about how elites or political figures are spreading misinformation. So that same study out of the UK found that most of the misinformation is coming from users, coming from the bottom up, ordinary people. But the content that's most engaged with on social media is coming from the top down. It's coming from those elites. And that just makes sense. I might have 2,000 Twitter followers. A celebrity could have hundreds of thousands or millions of followers. So when they say something, it has the opportunity to reach a lot more people. So that means we have a really important opportunity. Misinformation coming from the top is getting a lot of attention, and therefore that's a place where if we can respond effectively, we're going to address a lot of the misinformation that is being shared on social media without having to tamp out every single fire of misinformation that's kind of burning. So I want to highlight some of the key successes that I see in terms of platform efforts to respond to misinformation. First, promoting high quality information I think is really important. And it's a pretty straightforward and easy solution. It's limiting information voids. It's making it so people looking for information on COVID are going to find high quality information first and not accidentally stumble into misinformation. Second, collaboration among the social media platforms is really important. I'd like to see even more collaboration where we see things working on one platform and that being implemented in other spaces, especially when it comes to promoting official sources. But I think that that's a really important tool. And finally, the commitment to addressing misinformation that has been very public, that has been robust, and there's some evidence of success. I think more needs to be done. The fact that there is still a lot of content that's circulating that has been debunked by fact checkers is problematic, in addition to just getting that information and fact checking it. So I think that's a place where we both need to do more, but we're already seeing some notable successes there. Some of the challenges I see are addressing top-down misinformation is really important, but it's especially tricky when politics get involved. Social media platforms, health organizations want to maintain their credibility with the entire population. If they're trying to fact check or respond to misinformation that's being spread that has a political leaning or flavor, that's going to be much more difficult. They're going to run into struggles with people not wanting to believe them, trusting the advice from their political team, as well as just being more cautious. So I think that we need to really prioritize addressing top-down misinformation, both once it's already spreading, as well as limiting its opportunities to spread at all. Second, bottom-up misinformation is common and hard to detect. So I think we're going to need to rely more on the public, more on innovative solutions to help us identify the bottom-up misinformation that can spread quite quickly, kind of underneath the radar. Third, we need to think about coordinated misinformation. As the coronavirus pandemic continues, I think we're going to see more of this, where coordinated efforts to spread misinformation are going to occur. And I think most notably, we're already seeing this to some extent with the vaccination debate. The community of people who do not believe vaccinations are safe and effective are working to spread that message about coronavirus vaccination. And for this to be effective, we need everyone to be on board. And so thinking about the ways in which we need to respond to coordinated efforts with coordinated responses, as well as disinformation campaigns, which we know happen again in the vaccination debate, where bots and state agencies could be trying to sow discord deliberately through the vaccination debate. Finally, a challenge that's going to remain through all of misinformation, but especially COVID, is how do we define what misinformation is? That's something a lot of the platforms have kind of left opaque. And that's reasonable because misinformation can be really hard to define. So one way of thinking about it that I think is helpful is there's a very little bit of science that is totally settled, where you have complete expert consensus, where you have universal concrete evidence, where it's really clear, it's black and white, what is true and what is false. On an emerging issue like COVID-19, it's going to be emerging what is true and false. And you can see that in the types of information that's already spread. Guidance on masks has undergone a radical change. Initially, both the CDC and the WHO were saying mask use was not recommended, was not going to be effective. As the scientific evidence has come out, the scientific consensus has become clear. There is much more concrete evidence that masks are in fact effective, but it still can make those boundaries between true and false really difficult. So on an emerging issue, we have to be very clear when we're communicating about where the uncertainty is, what is the state of evidence, why we are making these recommendations, so that if we change our mind, if new evidence requires us to update those guidelines, people are aware of that. So trying to keep that emerging science very clear, what is misinformation and what is not, is important but difficult. Finally, I'll conclude with just a few recommendations. First, continue to promote high quality information, a coordinated effort between platforms, health organizations, political leaders to make sure people are getting the best information and finding it easily is very important. It minimizes the potential people are looking for accurate information and coming across inaccurate misinformation. I think also that making sure that the information not just talks about the risks and the severity of COVID, but gives people concrete steps that they can take in order to reduce those risks. We know that if you just scare people, they're often likely to tune out altogether or engage in maladaptive behaviors. If we tell people things they can do as well as why they need to do them, we're going to have a lot more success. Secondly, more efforts to respond to high-profile misinformation. And it could be that when high-profile source is spreading the misinformation, platforms, health organizations can respond directly, saying, actually, here's the facts on the issue, so that that high-profile misinformation is not reaching a lot of people. It could be, alternatively, that when you see a myth really gaining prominence, you're promoting high-quality information on that topic without responding directly. But when there is something that is really reaching a lot of people, there needs to be some kind of coordinated response, either kind of directly responding or responding separately to that misinformation. Third, efforts to think about how news literacy messages could be part of the solution. So there's a promising study suggesting that Facebook's effort to promote news literacy on their platform might have helped people recognize misinformation. We need more of those efforts to think about what news literacy education could look like both inside and outside of schools to help people distinguish high and low quality information. And finally, getting the public involved. So a survey that I did earlier this year in March suggested people really do think that the community needs to be part of the solution, that they like it, that they think responding to misinformation is everyone's responsibility. And so helping people figure out ways to do that productively, whether it's directly responding to misinformation when they see it and citing expert sources, whether it's helping them flag misinformation so that platforms can identify it more quickly and respond more quickly. Those are all different ways that we can get people involved. Misinformation is a community problem and it needs a community solution. We can't leave it to people, but we can help invite them in to be part of the solution to take action. Thank you. I hope this was helpful and I look forward to answering your questions.
Well, Emily, thank you for that presentation. She joins us now live along with Eva Guidarini from Facebook and Stephen Friedrich from the Washington Emergency Management Division. And we have time for a few questions. Eva, in your presentation, you told us about the efforts to label misinformation and the results that has yielded in terms of reducing the number of people who view that original content. It strikes me, though, that the public posts to the news feed that can be seen by a large number of folks on Facebook are one thing, but there are also more than 10 million Facebook groups, some of which are set to private, and some say that's a prime way to spread disinformation, whether it be about COVID-19 conspiracies or buses full of protesters coming to your town. Is Facebook trying to do anything to sort of monitor and counter those non-public communities?
Yeah, absolutely. Thanks so much for the question, Sean. So we do monitor private group content at Facebook, and our AI works across public and private groups. And so when we identify violating content in those private groups, we do remove it. It's also worth noting, I know you mentioned sort of earlier, we were talking about the labels that we put on fact-checked content. So those labels show up wherever that content appears on the platform. So whether that content is sort of at a very public page post in newsfeed or in a private group, that label will go over it, as well as sort of, once again, this artificial intelligence that's looking for violating content works in those public and private groups, as well as in those sort of much more public page presences. We've also made some changes to the way we enforce on groups. So we now have the ability to remove groups in full if we find the group admin is participating in or encouraging violent behavior or content. We understand that sort of the admin bears some responsibility for that group as a whole. And we don't recommend groups to people on Facebook when they routinely violate our policies or sort of toe the line of our policies. So we sort of reduce some of that group recommendation options. And we're also trying to give group admins and moderators additional tools to really help them manage their groups and sort of be a part of that community solution that Emily was talking about. And as a part of that, we want to make those moderators more accountable for the content in the groups that they moderate, give them more education on our community standards, and increase their requirements when it comes to moderating potential bad actors. And we also hold those group moderators to a higher standard because they play such an important role in moderating those groups. So if moderators post or permit the posting of violating content, then the group can incur penalties that can result in the group being removed from Facebook, or for less severe violations, prevent it from being recommended to others. So there's a lot of work happening in this group space to make sure that we're not just combating that sort of very public, highly spread misinformation, but also the stuff that's going around in these private groups as well.
Yeah. Emily spoke about also how addressing top-down or high-profile misinformation can be somewhat tricky when politics get involved. So, for Facebook, is it a trickier calculus for you all when the person sharing or creating content that potentially undermines the messaging of public health officials is the president of the United States? Does social media have a responsibility to either call out the president or to otherwise point toward information that may be closer to accurate?
Yeah, so politicians aren't exempt from our community standards, including our policies against coronavirus misinfo, voter interference, and incitement to violence. We do review and take appropriate action against content from politicians that does violate our community standards. That being said, we really believe that speech from candidates and elected officials is a highly scrutinized and debated form of speech, and we don't believe that a private tech company like Facebook really should be in the business of vetting what politicians say. I think it's really important that people should be allowed to hear what politicians have to say so they can make up their own minds and hold those politicians to account in elections. This policy has been on the books at Facebook for about 2 years now, and posted publicly on our site under our eligibility guidelines. And so it does mean, and I think there's an important clarification here, that while we will not send organic content or ads from politicians as like original speech to our third-party fact-checking partners for review, if a politician shares previously debunked content, so like a link to a news article that was rated as false, or a video or a photo that has already been rated as false, we do demote that content and put the screen on that content saying that it is misinformation. So if there is a politician who is sharing these sort of third-party sources that might be spreading misinformation on the platform, that content will be demoted and it will have that warning label there as well.
Stephen, did you or your department receive any blowback when you sort of called out President Trump for suggesting that people eat Tide Pods or inject themselves with disinfectant? And Eva, is that idea of Stephen's about sort of countering the president's message by telling folks, let's not make a bad situation worse, sort of a good way to handle it from Facebook's perspective?
It was my communications director was very supportive. Our governor's office retweeted our messages. I think it was important for people to understand that eating or injecting themselves with chemicals is very unhealthy. So the next day, several federal agencies did do similar messages. We just happened to be among the first to do so. We picked up a whole lot of people that were angry with us, but we also got the response we wanted out of the media to make sure that they had the right information to tell folks. For us, you needed to give the right information to the right people at the right time. That's sort of a FEMA basic PIO 101 practice.
Yeah, I mean, I think for us, the most important thing is making sure people have access to the most accurate information, right? In addition to discussions with family and friends and others like public officials on topics like COVID, people want to be connected to authoritative sources of factual information about these topics. So that's sort of the thinking that drove our COVID hub, the search module, reminders, things like that, and other efforts on this issue. And we really think the same rationale applies to governments. And I think Stephen and his team have done a great job in providing that authoritative information to their constituents about the topics that those constituents care about.
Yeah. Emily, can you help us sort of define the difference between misinformation and disinformation? Because I think they get used somewhat interchangeably, but to my mind, someone could be well-intentioned but simply misinformed, whereas disinformation is a much more nefarious sort of deliberate act of sabotage, trying to distract from hard truths and sort of cause chaos and dissension.
You've just identified the key difference between misinformation and disinformation. Misinformation is any kind of information that's inaccurate, kind of regardless of intent, whereas disinformation implies some purposeful meaning. So whether that is trying to make money off of it, trying to promote a political viewpoint, trying to sow discord for political purposes, all of that falls under the rubric of disinformation. It gets a little bit tricky on social media, however, because something that starts as disinformation can become misinformation or vice versa. If there are, for example, trolls trying to share something deliberately that they know is wrong, and then I reshare it out of, unintentionally without knowing that it's false, for me, it's misinformation, but for them, it was disinformation. Or if I share something that's false without knowing, and then somebody else retweets it because they want to make a political party look bad, and they know it's false, that would be disinformation. So one of the problems with that definition is when it comes to social media, in some ways, it doesn't matter for the audience viewing it unless they actually know what the sharer's intent is, but it does matter quite a bit when we think about interventions, when we think about how we need to handle it. We certainly don't want to impose the same penalties on somebody who's doing it out of good intentions, who is just trying to share information that happens to be wrong, versus somebody who's doing it strategically to advance some kind of benefit to themselves.
Yeah. Yes, Stephen, in your presentation, you talked about interacting with some of the trolls that you've encountered and the approach that your agency has taken to responding to them. Does part of deciding how to respond involve trying to determine whether a person is simply misinformed and could be swayed by you posting a link to a credible source, or whether they're just out to stir up trouble, and is it ever hard to tell the difference there?
So I'm just hoping that they're misinformed, not a true troll looking to cause havoc or damage. If they're just looking to get into an argument, I step away. Sometimes I will look to see how they're interacting with others on the page. So I won't even say anything. I try to take a cautious approach, but not a completely hands-off approach. This is a bit different than other agencies who don't reply to anyone ever. I'm trying to find that middle ground, which is also good for the Facebook algorithm that encourages engagements and increases the post reach. So I guess it's sort of finding that middle ground.
Yeah. Emily, how does this sort of conversation kind of translate into public policy at the federal level? We saw President Trump issue an executive order in May on preventing online censorship. There have also been a number of bills introduced in Congress that address this law called Section 230, or that try to create something called an Internet Fairness Doctrine. What do you think will ultimately be the impact of any kind of regulation or oversight coming out of Washington?
Well, it would certainly depend on what that regulation is in terms of its impact. I do think it's part of a strategic effort to discredit the media that has been ongoing for many decades. The media is an easy punching bag, and if you can discredit the messenger, then if they're saying something you don't want the public to know about, or you don't think is representing your views fairly, you can certainly rely on that argument that the media is being dishonest or being unfair. I do think that it introduces challenges, like I said, in trying to figure out how to respond to misinformation when it is political. Facebook has said that for political actors, freedom of speech is such a high priority that it changes how they're going to respond to misinformation. So I think Ava said that they don't send to fact checkers something that a politician is saying, but they do engage in the same kind of practices when they're sharing something that has been debunked. I guess my question to Ava would be, if fact checkers are going to engage in that anyway, and they do in fact say that something a politician has said is incorrect, what kind of actions does Facebook take to ensure that people are aware that that information has been debunked?
Sorry, I was on mute there for a second, guys. Yeah, so absolutely. So most of our fact-checking partners actually have very robust Facebook presences, sort of in addition to their sort of fact-checking units on the platform. And I think that speech and that debate is so important around the speech that politicians have. So I think that is a really critical sort of piece of how this works. And making sure that we sort of have that robust political debate, but also that when these politicians are sharing articles or other pieces of content that have been debunked by our third-party fact checkers, that we do have that label on them and that content is demoted as well.
Is there a way to, just to make sure people who are seeing the politician who is saying something false, not necessarily sharing an article that's false, make sure that they also see that fact checked, even if Facebook doesn't want to directly link the two, so that rather than saying, here is the video of, a politician saying something false and here's the fact check directly underneath it, still make sure that they coexist so that people seeing that video might still get the accurate information. And because one of the problems is it's great to have that debate, but if you're only seeing half of it, that, isn't necessarily helpful.
Yeah, so like I said earlier, we really believe that speech from candidates and elected officials is highly scrutinized on the platform. And so once again, this is a debate that can happen on the platform, and we do hope that folks will see sort of different sides and different components of the debate, but we do not directly fact check or label that direct political speech from politicians, since we think that speech is already so scrutinized. But we do sort of allow for that robust debate on the platform around that speech and around that content.
Eva, this was something that Emily spoke to as well. One of the easiest interventions against the spread of the pandemic that's been emphasized by public health officials has been wearing a mask. Yet that too has been somewhat politicized, and it hasn't been out of the ordinary to see misinformation or disinformation online, either questioning their efficiency, their efficacy, questioning why the guidelines about mask wearing changed over time, or the occasional horror story about this person wore a mask for so long and this horrible thing happened to them. But what's been Facebook's approach to encouraging mask wearing and discouraging other ideas that may distract from that particular public health message?
Yeah, so with COVID cases on the rise again in many states, we're putting those top of feed alerts, and I think I showed you hand washing ones at the presentation, but we're putting top of feed alerts on the top of Facebook and Instagram, reminding people to wear masks. So that's sort of like a great universal way for everyone to see that when they open up their Facebook and Instagram apps. And on top of that, we're doing some more to try to sort of combat some of the common myths that we're seeing on the platform. We recently launched Facts About COVID-19, which is a new section in our COVID Information Center that has like debunking articles for common myths about the pandemic. So you can go there and sort of see a list of those common myths and have those debunked for you as well. So I think it's really, once again, that two-pronged approach. We want to make sure that we're getting that good information out there at the top of feeds, reminding people to wear masks, but also making sure they have a really explicit place where they can go to and see common sets of misinformation that they might be exposed to, not even just on Facebook, where they can get that accurate information and be linked to an authoritative source as well.
Emily also spoke about the coordination of misinformation around a potential vaccine. As we think ahead to what we hope will eventually be the development of a vaccine that can provide herd immunity so that Americans can move beyond COVID and perhaps get back to something close to normal. There are concerns that a large number of folks may be unwilling to get the vaccine, either because they don't support vaccines in general, or because they're concerned about whether the rush to a vaccine in this case may prompt researchers to cut corners, or they're concerned that an entity like the Gates Foundation or the WHO might be involved in producing or distributing the vaccine. And a CNN poll in May indicated that perhaps a third wouldn't try to get vaccinated at all. Does social media have a responsibility to play in advocating for the efficacy of a vaccine once it becomes available, and trying to counter the anti-vaxxer or conspiracy-minded people who could undermine that whole process? Ava, do you have any thoughts on that?
Oh, sorry, I apologize. I thought that was for Emily. So I can't speculate on what a vaccine will look like at this point, but we will continue to pay attention to developments in this space, and then we'll make a decision like we did around masks. We recently decided to run those top of feed reminders around masks. It's just hard to speculate on the hypothetical when we don't quite know what that will look like.
Sure.
Well, I mean, this is Steven. So our state ran into anti-vax campaigns last year when measles was on the rise. Clark County, it's a county in our state, they did a heroic job combating misinformation. They actually just won a social media award for their efforts from the Government Social Media Association. So I'm sure that anything our state will do will take hints of what worked there.
Great. Well, folks, we are just about out of time for our webinar today. I don't want to keep folks too long, but I want to thank everybody again. Thanks to all of our presenters for joining us. This webinar is part of a series presented by the CSG Future of Work Task Force, which will issue a national report and policy recommendations in December. We look forward to future conversations on these and other issues. For CSG, I'm Sean Sloan in Lexington. Stay safe and be well, everybody. So long.